thanks for joining us here at the LSI conference.
Happy to be here, thank you.
You bet. And you're representing Privatera Acquisition Corp, right?
Correct, yes. I am CEO, CFO, and the Secretary of Privatera Acquisition Corp, and also part of the sponsor team that sponsored the SPAC, together with two of my partners. My partner, Vic Malik, who is my partner at Privatera Fund, and our partner, Bob Palmisano, who is also CEO and chairman of the SPAC.
So Bob's pretty iconic. I'm going to date myself right now. I go back with Bob to Summit Autonomous days where we were building the LASIK business, and then what did he do? Avedro, Intralays,
EV3, right.
Right. So I think there's a track record there.
Yeah, absolutely. Bob's phenomenal. I mean, I honestly don't know any other folks like Bob that managed to deliver such success, and we're just grateful the fact that he partnered up with us, and talk a little bit about our partnership with Bob, and just maybe a little bit of our team. So my partner Vic, whom I've known for, I would say, about 17 years. I actually, when I was former banker, when I used to be in investment banking, I used to work for Vic, and we kept in touch since we departed, and I've done a lot of things since I left banking, primarily on the operational side and investment side as well. And so we got together a couple of years ago at the former fund when I came in, helped essentially restructure some of the assets that they had before with an idea of starting Privatera. And so Bob used to be Vic's client for many years. So Vic knows Bob for, I would say, about 17 years as well. So Vic was essentially instrumental in helping Bob achieve his track record as a banker working with Bob. So I would say our team is really a cohesive relationship-based approach where we know each other, we work with each other over the course of last 16 years. And I think this is a great conduit to put a SPAC together. So I would say, we started having conversations about a SPAC back in 2020 at JP Morgan conference, the last time we were actually able to get together. Exactly. So Bob just announced the Wright Medical deal, which, judging from his track record, took him a little bit longer to close that transaction and that investment, but ended up being a tremendous success for him and the team. Essentially we said, hey, let's do a SPAC together. So at the time, I used to be, back in the day, my last banking job, we were one of the leaders at the SPAC market back in 2006, 2007. So this was one of the Wall Street veterans, Fred Joseph. There's a boutique used to be Morgan Joseph, doesn't exist today, but it's essentially former Drexel folks that, we used to work with Michael Milken. Things I read in, books about when I was in college. And so they were actually pioneering SPACs at the time, primarily working with, Chinese and sort of companies, et cetera, trying to break into the US market. And it used to be a very different product back in the day, so I was pretty familiar with it. I never actually worked on the SPAC deal, but I kind of knew about it more than, average person, I would say. So it was a very small kind of niche product for folks that never really had that much, attention from anybody in terms of, how to do a deal was a very different process. So I think the technology around a product has changed tremendously, and today it's a very different, almost, some people call it, 3.0 or 4.0, whatever you want. But I think it's much better way to achieve things. And I think, together I would say, SPACs are sort of a continuation of democratizing Wall Street for an opening up market for lots of different individuals that really didn't have that much niche, I would say, for them to help companies grow. And I think that what you see today, sort of the club is getting bigger. People have a lot more access than they used to. And I think, having different skill set to be successful, it's almost a new breed of folks that are coming out and becoming successful in this product.
The SPAC market, I think the numbers I got was $97 billion as of May 3rd. and 326 IPOs this year, and 130 mergers worth almost 290 billion, versus 12 deals last year at 8 billion.
Yeah.
Is there too much money in the market?
Yeah, look, I mean, I think it's, we have to put things in perspective, right? If you think of the stimulus package that's being approved right now, we're talking trillions now, right?
Yeah.
So, and I think, from our standpoint, I forgot to mention that, Privatera, we focus specifically in healthcare and fintech. And the reason why it's fintech and healthcare is because it's money and health. Those are the two things that are most important to each of us, right? And I think both of these sectors are sort of at the beginning of major transformation that is taking place. If you look at hospital systems, or if you look at our financial institutions, you look at the amount of banks and credit unions we have that frankly is still using MS-DOS software.
Right.
And if you look at hospital system, it's just mind-boggling.
It's a monolithic structure in the middle
Exactly.
of town that hasn't changed in over a century.
Exactly. So the amount of time and the amount of money you're going to have to invest to transform these two sectors is fundamentally insane, in my opinion. I think you're going to have to pour a lot of money. So when you think of, the SPAC market, yeah, I mean, look, it's very fast and easy. Well, it used to be, at least, until April ACC regulation that came out to put essentially brakes on the SPAC market. So I would say that over the course of when this whole craziness started, I mean, essentially begun with biotech, right? So you had kind of like late of 19, you had biotech companies coming out. Immunivant was one of the first sort of deals that came out at the time. And it was more structuring. It was more sort of, you could try and find a way to get the deal done. There was earn-outs and all kinds of complexities around it.
But biotech also is unlike device, where biotech will give you value on future, where medtech usually is just today, right?
100%. That's why I think from our perspective, we're really focused on medtech because you actually can feel and sense what you're working with. It's more immediate. It's primarily a commercial story. And something that is feasible. You can actually have revenues. So, and I think with the biotech, definitely there's been a lot of advancements, and it's an exciting space to be in. I think you certainly have to have a lot of scientific background to be successful in that space. And from our point of view, our SPAC is 100% focused on medical devices and technology. So we, when we started this process, originally, we kind of had, going into the IPO roadshow, we had, okay, look, there's been over 58 billion invested into medtech companies that are essentially private over the last 5 years, from private equity and venture capital together, right? There are 4,100 private medtech companies. So when you think of that space, you say, wow, that's a lot, right? And then when you kind of go down and say, well, who's ready? Who's ready to be a public company? And do you have the right team? Do you have sort of what it takes? Is there a track record, is there success, et cetera? So I think in medtech space particularly, it's much more feasible. It's much more near-term objectives. So you have to kind of know the space and subsectors. There are lots of subsectors in medtech. It's almost different industries in one. And Bob's background is phenomenal because he's done ophthalmology, he's done cardio, he's done orthopedics. So so it's and again, it's like we were tremendously impressed by the number of great opportunities we saw. And I think the IPO pipeline right now that looks sort of companies that are near term to go public are also very impressive. I mean, typically you see 5 to 7 companies go public every year. I think now it's getting bigger, and I think the investments that were made over the course of 5 years are paying off. Specifically, I would say a merger of device and technology and computer science together. I think that's just, that combination alone is tremendously transformative.
You bring up an interesting point there. Historically, when we think about medtech, we think about 510K, PMA, IDE, right? FDA regulated devices. However, the technology and the smart money coming in, and I don't mean smarter than current medtech, I mean non-medtech money that is tech related, that's now coming into the health tech field, is non-FDA regulated focus on what was historically the fringes of the curve. And those are the ones that are going to move the market, I believe, because medtech typically focused on the OR, right? And that small vertical. Yet what's supporting it, the infrastructure, I believe, is where I think the SPACs can really help the market quite a bit. Because making a mistake on the regulatory clinical side, if you don't understand the industry, is going to burn a lot of people.
That's true, and I absolutely agree with you. I think that, and you know, again, we have seen a lot of techies going into healthcare, and of course, you know, some of them try to go to biotech, but I think it's, like I said, it's a very specific field where you need to really have scientific background. But a lot of them also going to medtech, where it's device-based, right? So I think if you look at particularly, you know, in the diabetes management, there's a lot of great stories where you have, you know, tech CEOs that made, you know, had a pretty good track record in their field, decided to go into healthcare, and you know, becoming and creating a lot of value, particularly in that specific category of you know, of the disease. And you know, if you go back, look at partnership between Google and Novartis, and you know, they tried to do it in the corporate way, and it's not that easy as people thought. Or look at you know, trying to change the healthcare system, the triangular partnership between you know, Amazon, JP Morgan, Berkshire Hathaway.
As soon as that came out, I could have told you that wasn't going to work.
It's complex, right? So, and I think that you know, a lot of people are getting to it, right? So, I mean, look at Tesla, right? So it's possible. So I think, you know, there's definitely needs to be more of algorithms and technology together with healthcare that will essentially help doctors, practitioners to adhere to better results, right,
so
for the patient at the end of the day.
You think about these big markets. You mentioned it, chronic healthcare, right? So I think 80% of the 20% of the GDP that we burn through in this country every year is geared towards chronic management of chronic healthcare. So that's number one. The second one is it requires us to get away from a craft, because healthcare and medtech has been a craft. It's one surgeon, one clinician performing an amazing procedure. It's not digitized, it's not scalable, and it's only addressing a very fine sector. So the industry has not been driven by data. And so you mentioned fintech, and you mentioned Google and Amazon and Apple. Those are cultures driven exclusively by data, not emotions. And so health tech is going to have a wrestling match there.
Absolutely, I couldn't agree more. I think, you know, when you always look at the company, you always say, well, numbers tell the story, right? So any investment decision you make, it has to be backed up by data, backed by results, operational decisions, you know, everything else, it's all data driven. Bob is very well known specifically for, you know, driving decisions based on data, as you know, right? So I think, you know, our view is that we definitely believe that the change in data-driven management style, which you can see on how do you assess each individual doctor performance, right? How many, let's say, reinfections or et cetera. So the payments, so the service industry is already tracking that performance, data-driven performance. So I think enabling the doctor, the practitioner, enabling the patient, and helping them to be more involved in their own health, I think is something that we'll need to work on, because obviously COVID showed that how unhealthy our country is, and frankly, to be number one power in the world and to have such unexpected health outcomes, something needs to change. And I think that, you know, to me, I worked in pharma, and I, you know, realized that the biggest change that needs to happen is what we eat, frankly. So it's agriculture. That's the biggest, you know, elephant in the room, frankly.
Right. Well,
that
not
needs
if you're in France, right?
Exactly. In France, you don't get those kind of things, right? Because there's an old
moderation,
system. Exactly.
And quality of food.
Absolutely. So there's an old system that still works and transfers into outcomes.
So what are you going to be looking for at LSI while you're here?
Look, we have the way we kind of see ourselves in the SPAC market as well as in direct investment fund. We really focused on long-term value. It's really not a sort of financial, shenanigans, or flipping the company quickly, making the money back, fast, and sort of moving on to the next one, because essentially that sort of catches up with you. So we really view that as a sort of long-term partnership, and going into the story, helping grow the business, help advise management and expand and augment the team, help operationally at the board level, M&A, et cetera. So this is kind of the same thing we're doing on a day-to-day basis. So our view is really partner up with folks and stay with them for a longer term until the ultimate exit. So I think from our view, we're definitely, Vic and I both are going to be here meeting with, we have, I think, 30 companies in the course of next 2 days. And our view is really find, opportunities where we can see ourselves partnering up with these stories that are unique, that are, addressing either a niche market or kind of better meet your story. So, it's kind of hard to say in one sentence, because there's just so many, specific dynamics that kind of work around that, as you know. So, but, we're very excited. I mean, it's the first time that, everybody's getting together after a long break, and, we're very excited.
Awesome. Well, I appreciate you taking time out, busy schedule.
Thank you.
Talking
Happy
a little
to be
bit
here.
on SPAC.
Thank you, sir.
Be well.
Okay, thank you.
Joe Mullings from LSI. Be well.